I am Dr. Sanjay Vaidya, consultant plastic and diabetic foot surgeon at SL Raheja Hospital, Mumbai. Let me first wish you all a healthy heart and a happy and long life on the eve of World Heart Day. I will share with you a very interesting observation. Nowadays, I see a lot of people who are into share market. They check the Sensex, Nifty, ups and downs of share market, accordingly take the corrective action. They even have financial consultants who look after the well-being of their finances. But what about their health? How many of them check their blood pressure, blood sugars regularly, go for regular health checkups? Very few. Now remember, health is wealth. In fact, I would put health is more important than wealth, because the share market which comes down will go up sometime, but once your health goes down, it will not come up again. It is very difficult to restore health. What is the scenario? If you look at it, young professionals going up the corporate ladder or young entrepreneurs, they are very busy in their schedules. They will have multiple meetings scheduled throughout the day. So they will be having multiple cups of tea or coffee along with cookies sitting there. And if there is a stressful situation, they would go out, have a couple of cigarettes, and come back. In the evening, they will have a couple of pegs. For dinner, they may have pizza, burger, or sandwich along with Coke. All this leads to health concerns and problems, and suddenly one fine day, still they are dead. At the other end of the extreme, you will also see some fitness freaks. They will run marathons, they will hit the floor on the gym every day, work out for hours, and sometimes suddenly you will find like a collapse on a treadmill. Now, what is common amongst both these people? Stress. So, what is important to remember is we have to definitely take care of our lifestyle, see to it that the stress is reduced. Now, again, when you ask whether you have done regular checkups, as I mentioned earlier, many of them will say, शुगर थोड़ा हाई है, क्योंकि गणपति में बहुत मोदक खाया. Then there will be wedding season, New Year, something or the other is going on in India. So that is not an excuse. Also, some people will say, diabetes runs in our families. I tell them, diabetes runs in your families because nobody runs in your family. So it is very important to remember this. Now, because of all this, what's happening, unfortunately, is all these young professionals, they are becoming rich at a young age, but they are also, these ambitious people are also dying young. That is a very alarming situation, because what is adding to this problem is diabetes. As we know, India has become the most populous country in the world. We have got a dubious distinction of India being diabetes capital of the world. According to the latest study of Lancet, in India, there are more than 100 million diabetic patients. Now, remember, diabetes is a multi-system disease. It affects eyes, it affects heart, it affects kidneys, and is again, once the patient starts going to a diabetologist, normally you would take care of his sugars. Patient would go for annual eye checkup. They would check their creatinine to see the kidney function. They will also get their ECG and 2 echo done so that they know what is the heart is behaving normally or not. But fit is the most neglected part in the management of diabetes. And why it is important? 15 to 25% of them are going to develop some food problem in their lifetime. That means we are looking at about 15 to 25 million people who will be affected with diabetic food problems. And why this happens? One is neuropathy, that is loss of sensations in the feet. So they don't realize there is a trivial trauma. Coupled with that, there is a reduction in circulation in the leg. So all this leads to food problems which are avoidable. In fact, about 85% of the patients with diabetes who have amputations, it just starts with one small wound, which ultimately gets infected and can lead to a below knee or a above knee amputation. And by conservative estimate, in India, every year, there are about 200,000 amputations happening every year because of diabetes. And this is totally preventable. Again, let me tell you a scenario which we come across very often. And it is very important to know this. A patient gets a small wound, say on the little toe. He will just try to do some dressing. And one fine day, he finds that the toe is becoming black. That is when he will approach a diabetic foot surgeon. During examination, we find that, oh, there is some redness higher up in the leg. That means he has developed infection also there. There is a cellulitis and there is a toe gangrene. Patient is advised immediate admission. On admission, when we do routine investigations, we find that the Doppler or sonography of the leg shows that there is a markedly reduction in the circulation leading to gangrene. Now that has compounded the problem. Now there is no circulation. So we have to call an intervention radiologist first to check the vascularity. If there is a obstruction in the blood vessels, we have to get an angioplasty done. During routine course of investigations, sometimes we'll find that even the creatinine is raised because of infection. The kidneys are getting affected. On top of that, sometimes we have seen patients suddenly becoming breathless a day prior to planned angioplasty. Saturation drops. Then we shift the patient to ICU. Then we realize that patient has developed a heart failure. Patient and relative, they are at a loss. We have come for a small toe which has become black. There is a physician who is involved along with diabetic foot surgeon. Now suddenly we are asked that is the intervention radiologist or a vascular surgeon is required. Then the kidneys are affected, so nephrologist is involved. And now patient is in ICU, so cardiologist is involved. And then we find that the ejection fraction has dropped. That means his heart functioning has become less. Now comes the question, along with angiography of the leg, whether to do an angiography of the heart as well. And more often than not, if you do the angiography of the heart, you will find that there are blockages because there are enough number of papers across the world which show that if there are blockages in the arteries of the leg, there are blockages in the heart arteries also. So it is very important to remember that it is not something very simple. What looks to be a small, tiny wound or a gangrenous tip of the toe, it can have really a multi-system involvement And what patient should realize that actually after doing all the tests, we are putting a mirror in front of him. Look, this is what your health is. What I want to stress is not something which has to be taken lightly. Let me just put a take home message, certain do's and don'ts. Don't ever smoke. Don't drink alcohol. No junk food. No cheating on your diet if you are detected a diabetic. I mean, it's once in a while, it's okay if you're going for a wedding and you have a little sweet. But that doesn't mean you should be going to the wedding every day. And in do's, what is important is following a proper diet, doing regular checkups with your doctor, follow the advice given by your doctor, do a moderate exercise. Walking is the best form of exercise. Take care of your feet. It's very important to inspect your feet daily. Look for any small wounds, cuts, corns, calluses. Go to the doctor immediately. Get the adequate treatment done. Do along with exercise, physical exercise, which is important for the body. It is also important to do yoga and meditation, which I will say is exercise for the mind. So stay healthy, stay fit. Thank you.